Welcome to CSUN's Biology Department Bio 107 Pig Dissection video. My name is Stephanie and I'm here to help you through your dissection for today. So first off, you should have your manual, the same manual that you guys have been using all semester with all your instructions in it. And we should also have your TA has given you a vocab list. So this should tell you everything that you're supposed to see on week 1, week 2, and week 3. You should really be keeping this with you at all times. You should be checking it off, making notes on it. This is really everything that you need to study for your test. So any of those vocab words on that sheet could be on your test. So your TA will also give you a little pig in a bag. You notice there is some liquid in this bag, so what you want to do first off is cut a little corner and then dump this liquid out into the proper receptacle, meaning the pig juice bin and not the sink. So once you've got your pig and your tray, you're basically going to start using your dissecting tools. And so the two tools that you really should use most often are your tweezers and your scissors. And that's because you want to lift with one hand and cut with the other. It should always be the same person doing the dissection, not one person holding tweezers and the other cutting. You really want to control and make small cuts. And so what you want to do is you actually want to lift up the skin layer by layer. So we're going to cut single layers and right at that connective tissue to slowly pull back that skin or whatever layer that we're getting into. You never really want to use your scalpel unless you're getting into the mouth and you have to break some jaw bones, because the scalpel you can't control, and if you were to pierce you have to push so hard down on it you really can't stop where you're going into, and then you start cutting up a lot of really valuable small arteries and veins and stuff like that, and we don't want to do that. These probes are really great for scraping through membrane. So if you have a very thin membrane, you can just kind of scrape at the tissue and that'll break it up. And that, again, you don't have to use your scalpel or scissors or anything like that. And this is also really great for pointing stuff out to each other because it is a nice fine point. These pins are useful if you ever need to pin down a part of the pig. Say his arm keeps flapping open and you want to keep it down. You can put a pin straight directly into that because our wax trays, again, are filled with wax on the bottom, so you can stick the tools straight into the trays. We will be providing gloves for you. Gloves are not to leave the classroom. Gloves are only to be used in the classroom. If you need to change your pair of gloves, that's fine, but please don't be wasteful. And also, last but not least, your goggles. Goggles are absolutely necessary. You won't be able to do the dissection if you don't have your goggles. And they must be the ones that completely cover your eyes. So none of those ones with the sticks. You actually need the full eye covered goggles. And like I said, they are mandatory. So with that, let's get started. So once we take the pigs out of the bag, that's when you have to have your goggles on. So anytime you're working closely with the pig, the goggles must be on. If you need to take a step back or go get some fresh air, you can take the goggles off, no problem. But if you are working with the pig and up close, you need to have the goggles on. You should also have your hair tied back in case you want to lean forward. The hair does get in the pig sometimes, so you want it nice and pulled back and out of the way. You also want to make sure that you have your gloves on, and again, these gloves never leave the classroom. So let's go ahead and get started with the external anatomy. So the first part we want to start with is determining whether our pig is a male or a female pig. Now you are responsible for both sexes. Doesn't matter if you get a male or a female, you are still responsible for the other sex. So the first thing we want to do is determine which sex it is. And usually what students do is they look at this underside here and they see these tiny little mammary papilla. And papilla means little bump. So these mammary papilla are also known as nipples. So they say, oh, it has nipples, it must be a female. Well, I could point to any male in the room and say, he has nipples as well. So that doesn't exactly work. So what we want to focus on is this area right here. This is his umbilical cord, and that's where the fetus is attached to the mother. But right below that, right here, this is our urogenital opening. And because this urogenital opening is located just below the umbilical cord, that means he must be a male. So another way to confirm this is if we look back here towards the anus, you can see this bump, and this bump is very distinct, two little bumps right here. This whole part right here, this is his scrotum. Inside are his scrotal sacs, but this area right here is known as the scrotum. Again, another indicator that it's a male. If it was a female, if we looked right here underneath the tail, right below the anus, there would be a small bump right here. That small bump is known as a genital papilla, or genital covering her urogenital opening. So again, the genital papilla would be this little bump right here, and her urogenital opening would not be up here, it would actually be back here. So let's go ahead and look at a female so we know what that looks like. As we examine the female, the first thing you can notice is, yes, she does have these mammary papilla right here, but the first thing she does not have is this hole right here, and that hole was the urogenital opening. So if we look right under this umbilical cord and we don't see a hole right here, that means it is a female, and her urogenital opening will therefore be back here. So again, we lift up the tail, and right underneath the anus is this bump. And again, this little bump right here, this little flap, is known as the genital papilla. Again, papilla just means bump. And if you were to pull this back, you could see a tiny little hole. That little hole is her urogenital opening. Again, different from the male, as her urogenital opening is going to be back here, while his was up here. Okay, so next we're going to move on to the cheek dissection. And where you want to start with the incision is they're already going to have this large incision in the neck. And we really want to start there. And this incision was made because they inject blue into the veins and red into the arteries. So that'll help you once we open this guy up to determine which one is which. So now we know, because we can see in, that we're not really going to hurt anything. All this fatty neck tissue right here, this is all parotid gland. So the parotid gland is very thick, and again, it covers his neck, and this is for protection. So what we're going to do is we're going to lift up, again, one hand with the tweezers, the other hand with the scissors, and we're going to cut just below the skin, right at this connective tissue. And again, you can kind of look in and see that once we just cut this connective tissue, we're really not going very deep, and we're not hurting anything. So you can slowly start to peel this away. Now you want to go very slowly, much slower than I'm going, because there's fragile things here, very shallow, that you don't want to cut away. So you always want to remember that you want to remove any large pieces of skin. You don't want to leave this so you can't see. You want to remove it so that you can get a nice clean look at your pig. And then again, we want to lift and cut very shallow right at that connective tissue, because we don't want to go too deep. And the first thing that we should see here is this big round cheek muscle. That big round cheek muscle is going to be known as your masseter muscle, and that controls the jaw. So as we remove this, you can see I'm just cutting at the skin. I'm not going too deep, just cutting these connective tissues. And then we're going to remove that, and you can see in nice and clearly right here. Okay, so we've got our big masseter muscle right here. We've got all this parotid gland out here. So the next thing you want to do is you want to start working your way through this tissue. And this is where that scrape really comes in handy. So you can kind of scrape away without actually cutting or damaging too much. See, we're going to keep scraping away. Really getting through here. Seeing this nice, clean cutting. Okay, so what we can see right here, this very small white line. And you notice it goes across the top of the masseter muscle. This is the masseter muscle here. This very thin white line that goes across, this is your facial nerve right there. And again, that controls your facial features. So you don't want to cut that away. And again, a lot of people do, and that's okay. You do have another cheek if you want to try again. But this tiny little white line, again, going across the top of the masseter muscle, that is your facial nerve. So going below, and you can see this right here, this thin white line going below, leading into all this parotid, this is your parotid duct. And again, your parotid duct has all these arteries behind it. That's how you can usually tell. And that parotid duct will feed right into this parotid gland, all this fatty neck tissue. So if we keep going a little bit, go a little bit farther down the parotid, what you should expose, and your book even shows your tool pulling all this away and uncovering the gland underneath, this right here, this right here, this gland is your mandibular gland. So again, to the right of the masseter muscle, underneath all of this parotid, this fatty neck tissue, it's going to be this little bean-looking thing. And this little bean-looking guy right here, that's your mandibular gland. So it's important to note that most glands are either going to look like fatty tissue, like this parotid gland, or they're going to look like tiny little beans, like this mandibular gland.
Rolling and action.
So the very next thing you want to do after your cheek dissection is you want to tie up your pig. And the whole point is to keep his arms nice and wide and his legs nice and wide so that you can work all along here without him flopping over and getting in your way. So what you want to do is you want to tie one wrist very securely, and you want to wrap the string underneath the tray and then tightly to the other one. So I've tied this leg here, as you can see here, and then you run the string below the tray, and then again you tie the leg nice and tight. And these knots were going to stay on there. So later when you actually remove the pig and put him away for the day, you're just going to slide these strings off and keep him on the strings so that you don't have to retie this every single week. Right now I'm going to tie a nice tight knot and keep my pig nice and splayed open. I find if you need to tuck it around the leg to make it a little bit tighter, you can do that. So now he's nice and wide open. So now we can start working on the mouth. So this is the one place where you actually want to use your scalpel, and that's because we're actually going to be breaking these jaw bones here. So what you want to kind of do is you want to almost joker him and keep his smile going all the way back. What we don't want to do is lob off his whole head. So when you are cutting down here and into these jaw bones, what you want to do is you want to follow the tongue down, as if you were a piece of food. You want to get down into the throat. Not into the head necessarily, but definitely into the throat. And at this point you should have taken all the pictures of your cheek dissection already, any pictures and videos that you want, because a lot of the times the students will cut right through this very delicate area. So you want to make sure that you have everything done before you move on. So what we're going to do is we're going to open his mouth here, and we're going to begin our incision on each side of the mouth. I know it seems a little brutal, but we got to do it. So then you can actually hear where the scalpel starts breaking into these bones. And again, you really want to focus on going down the throat and not into the head. So as I'm cutting along here, I'm just cutting enough to get down the throat. So you don't want to lob his actual head off. So you just need to cut those muscles and those bones that will prevent you from going down the throat. And you want to keep pulling this back, nice and wide, nice and wide. It's okay if you see a little bit of food in here. Don't worry about that. Keep cutting, and then there. You can stop once you see this little flap. And this little flap right here, that little flap is the epiglottis. So that epiglottis will actually flap up and down as you breathe and swallow. So it flaps up, so when you can breathe, that your airway goes all the way down, and it flaps down to close off when you're swallowing so that food doesn't enter your airway. So what we can see here, this major hole that goes all the way down the throat, that's the esophagus. This little hole that goes into, almost into the tongue, what it looks like, that is your glottis. This flap is your epiglottis, epi meaning on top of the glottis. And then this passageway that goes up towards the nose, that is your nasopharynx. So think nose, nasopharynx, this passageway right here. And then in the top of the mouth, the roof of the mouth right here, you've got your soft palate right here, and your hard palate up here. And you can feel this one's very hard, and this one kind of gets nice and soft right back here. Okay, so we're all done with the mouth, we're all done with the cheek. The next thing we're going to work on right here is the throat. And since we've already opened up this area here, what we're going to do is we're just going to start working our way over here. And again, there's all this neck tissue, this fatty material here. This is not really important, so we're going to be able to cut through this pretty easily. The thing I want you to look for is this little ball in the throat right here. And you can't see it, but I can feel it under my finger. So if you feel this right here, if you feel down the neck, you'll actually be able to feel that ball in the throat. And that's actually true of humans as well. And that ball in the throat, that's actually your larynx. So you're going to be able to cut all the way down until you hit that ball. And then don't cut the ball away, but you're going to want to cut around that and down into the trachea. But don't worry about all of this material in here. There's a lot to go. So make sure you work your way from here over. And now I'm going to show you guys what that looks like. So now we've cleared away all of this fatty tissue in the neck to reveal this large ball in the throat. And again, that large ball in the throat, that's your larynx. This is your voice box right here. So if you were to follow this down right here, this bumpy tube in the throat, that's your trachea. Very, very distinct structure right here. That's your bumpy tube, that's your trachea. This is your airway, okay? Sitting below that, this tiny little bean-looking guy, this is your thyroid gland. And again, remember, beans always look like fatty material or little beans. Did I say beans look like beans? Glands look like beans.
I don't know what you just said.
Shut your face. So larynx, this big ball in the throat, is the larynx right here. Following down to the bumpy tube in the throat, that bumpy tube in the throat is your trachea. And then sitting on top of the trachea, this little bean-shaped guy, this is your thyroid gland. So this little dark bean-shaped guy is your thyroid gland. And that's pretty much everything in the throat. Okay, so now we're going to move on to the body cavity, and what's really important is the way you cut into the pig. So if you have a female, you're going to cut around the umbilical cord, but cut all this away. If you have a male, you're going to come up here above his urogenital opening and down and leave this flap intact because that's where his reproductive system is. So again, follow your manual closely and it'll tell you how to get in here. Now, what I've done is I've kind of cut this first layer of skin off right here, and then I've exposed this diaphragm. So it's a very thick membrane that covers your entire body cavity down here. So this guy right here, underneath your skin, this thick membrane, is your diaphragm. So I've started in here on the side because I know there's not really much that you can hurt on either side of him here. So I usually pinch a bit of skin, stick my probe in it, and then start cutting around that. So what I've already done here is started to open this up, and the first thing I want you to notice is that you can almost see directly into the pig. And he's not really attached to anything, meaning that skin is not attached to any of those major organs. So we can actually make large incisions without harming anything. Now, if your pig has more juices on the inside like this one does, that's okay. You can go ahead and squeeze him out and take him back over to the pig juice bucket and dump out those juices. Remember, those juices never ever go down the sink. So now we're removing this little piece of diaphragm, and you can see very clearly now that this just opens up nice and cleanly. And you can see right in there. See how nothing's really attached? And we can start to expose this liver. So now I can go ahead and make much larger cuts because I can see what I'm doing. And that's always the key, is you want to cut away so that you can continue to see what you're doing. And you might have to break through some ribs, and that's okay. These are fetal pigs, so they should cut off very easily. Again, we've got more of that diaphragm right there. See, and we can just cut right in there and expose all this good stuff without harming anything. And again, I've got a male here, so I'm going to cut around this flap. If you were cutting a female, you would simply cut around this umbilical cord, leaving the umbilical cord attached, but removing all this excess skin around. So we want to remove this excess skin, leaving that flap nice and intact, just like so. And remember, you guys want to go very slowly, much slower than I'm going. I've done this a few more times, so don't go as fast as I go. Alright, so then we can see our diaphragm, we can cut this excess skin away, and we can start to expose these central organs. Okay, so the first thing you guys should do once you kind of get in this area and you can start seeing everything is you want to cut this little vein right here. Remember, veins are dyed blue, arteries are dyed red. So we want to cut this little vein, but we want to cut it so that we can see it was coming out from under here and going up to our umbilical cord. So this is actually our umbilical vein. So we know, okay, it was attached here and here, but now we can kind of flap this down and we can really start to see some more of our organs. Moving on to the chest cavity, it's surrounded by a similar chamber just the way the body cavity was. So once you break into that chest cavity, again, we're going to be able to look around and see our way. So what I do is I start way over here on the sides, because on either side, the only thing that you can possibly nick is the lungs. And we know what the lungs look like, or at least you will know what the lungs look like. And they're very large, so even if you nick one, it's not the end of the world. So this was originally covered here. Again, this outer layer membrane is the diaphragm. So now I've kind of cut in on the side over here, and this is my lung. This is one of the lobes of my lung. And just like the body cavity, you can see how it's not really attached. We can almost look right in there, and nothing is actually attached. So once you get into the chest cavity, then you can start making these larger incisions without hurting anything. So now I can see you can peel all this back, again breaking these tiny little ribs, and you can lift this up and say, oh, okay, I'm not really going to hurt anything. And it's key to always lift up and look in when you're cutting. So I can lift up and look in here and see, oh, okay, there's nothing really there, I'm not going to hurt anything. And you can start making those incisions. What's really important is once you get here, this is the breastbone right in between the arms. This has a lot of circulatory system right here. So a lot of very thin veins and arteries. So we want to avoid this area until week 2. But for right now, we want to cut as much of this open as possible. So now I'm going to cut just above the rib cage. You can see here, just below the rib cage, kind of separating this membrane from the ribs. And then I'm lifting and cutting away. So now we start to see the heart. So this is the lower part of the heart. And as we get in here, again, you want to slowly remove these ribs, but we don't want to go too deep. This is a thin membrane that surrounds the heart. If you go too deep, you'll actually cut that away, and we want to see that before we actually get below that. So I'm cutting this away, kind of cut these connections between the diaphragm. You can start to see more of our lungs right here. This is a giant blue vein, that's our vena cava back there, but we're going to get back to that. Let's see if we can kind of get in and expose our heart. Okay, so again, this is our heart right here. And so this membrane that's covering the heart, this is our pericardial membrane. Para meaning around, cardia meaning heart. This is the membrane that surrounds the heart. So we want to cut all these ribs off up here without getting too deep and exposing our circulatory system, because we're going to do all that on week 2. So you can see here we've really exposed this chest cavity right here. So you can see our big lungs on either side. You can see our heart still covered in that pericardial membrane, this very thin membrane right here. And then sitting on top of that pericardial membrane is the thymus. The thymus is this flat looking, kind of almost gland looking guy sitting on top of the pericardium. Now once we get onto the pericardium, there's going to be auricles and all sorts of other stuff. But we need to remember that if we're on top of the pericardium, then it's going to be our thymus right there. Good. Now going into our chest cavity, again you see the lungs here on either side. All of these lobes are lungs. So you can see this very thin material, so flaps here. These are all lungs. And again, this membrane that surrounds our heart, this is our pericardium. And above the pericardium, on top of the heart, is this thymus. And this area right here, this is all thymus. So what we're going to do is we're going to kind of cut this pericardium away, but we're going to leave the thymus there. So we're going to cut it just enough so that we can kind of flap it back, but not get rid of it. So we're going to cut right through here. And that's to expose everything underneath that pericardium, including many of the parts of the heart. So now we're going to take this thymus, we're just going to flap it up a little bit. Okay. So once we do that and we pull the heart down, first thing you notice is these dark flaps on either side of the heart. These are the auricles. And again, we're never going to tell you the difference or ask you the difference between the right and the left auricle. We're not going to worry about that. But you should know that underneath the pericardium is going to be the auricles, while above the pericardium is going to be this thymus. So again, we're going to keep this thymus back here. And you can also notice this big white thing coming out here on the right hand side, the pig's left hand side. This is your pulmonary artery, right? So that's where that deoxygenated blood is coming from the heart and going to the lungs. That pulmonary artery, this big white one right here. And then if we pull the heart down, and kind of behind these auricles, like so, you can see this giant white thing right here. And if we were to actually cut this membrane and separate the pulmonary artery from this, you'd see that arch. And this right here, this big old white one, this is our aorta. Right next to it is the big old blue one, that's your vena cava. This is the aorta, this is the vena cava, pulmonary artery, auricle, heart. So we probably won't test you on the parts inside the heart, but we might. So remember, you need to be familiar with the atriums inside and the ventricles. Don't forget that crossing straight across the heart, this guy, he's not stained very pink, but the only thing that crosses the heart is that coronary artery. So that's this little thin line right here, that's the coronary artery. If we lift up the heart down here, which you can see, if I cut some of this pericardium away, is again, this is another continuation of that large blue vein right there, and that's the vena cava. So this would be your caudal vena cava, and this one above the heart here would be your cranial vena cava. So remember, the vena cava goes all the length of the body. Next, we're going to move on to the actual blood flow through the heart, and this will really help you, again, distinguish the different parts of the heart. Okay, so we're going to start here in the vena cava. And the vena cava is the largest vein. It travels all over the body and it brings deoxygenated blood back to the heart. That's very important. So you need to remember that veins bring blood back to the heart, where arteries send blood from the heart to the body. So we come in the vena cava, either the caudal, which means below the heart, or the cranial, which means above the heart. And both of these will enter into the right atrium. So again, this is my right, the pig's right. So this is my right, it comes in the right atrium. Atriums are the top portion of the heart, ventricles are the bottom, because we as humans and pigs also have 4-chambered hearts. So it enters deoxygenated into the right atrium. It travels down the tricuspid valve. This is one of our AV valves, known as the tricuspid valve, into the right ventricle. And then it comes up and out the pulmonary valve. This is our pulmonary valve. And then I'm going to draw a dashed line, because don't think of it as going through these 2 chambers. Think of it as kind of going out and behind the heart. So we're going to travel up and out here to the pulmonary artery. And that makes sense, because we go from the pulmonary vein to the pulmonary artery. So we come up and out, and this is where we actually go to the lungs. So remember, artery means from the heart. So this is the only vein in the body, the only artery in the body that is deoxygenated blood. This is that pulmonary artery. So it comes out to the lungs. Now we're going to transition down here. So this is actually what's happening in the lungs. Is you've got this deoxygenated blood which flows in, and it flows over these capillaries. And these capillaries have very, very thin membranes, and they're exposed to the oxygen. And that allows the blood to pick up that oxygen, becoming oxygenated. So when we leave the capillaries and when we leave the lungs, we're going to leave nice and oxygenated. So then we're going to come from the capillaries in the lungs through the pulmonary vein. Again, vein means to the heart, so this is the only vein in the body that is oxygenated blood. So we're going to enter in the left atrium. So remember, always atriums first, then ventricles. So we go into the atrium, we're going to go down another AV valve. This AV valve is known as the bicuspid valve. So tricuspid first, then bicuspid. We're going to enter the left ventricle, and then we're going to actually exit the heart through the aortic valve. This is an aortic valve, and again, this dashed line means I'm going behind, and then we're going to come up and out the aorta and go all the way up towards the head and down towards the rest of the body, sending oxygenated blood all throughout the body. Okay, so now I want to go through this diagram with you guys so you really understand the positioning of all these organs and the difference between them, so that when we actually get into the pig, it'll be easier to identify each one of them. Okay, so we're going to start at the top where the liver is. So imagine that we've lifted up our liver. So we're looking kind of underneath our liver. And this is going to be on the right-hand side of the liver, and that's the pig's right, not your right. The pig's right. Underneath the liver, we're going to have this tiny little deflated sac, and this is going to be the gallbladder. And that's because the liver produces bile and the gallbladder stores that bile. So the bile duct is actually going to be this tiny little tube coming out of the gallbladder, going down towards the duodenum. Now, also underneath the liver, but on the left-hand side, we're going to have this large deflated sac right here, and that's going to be your stomach. And it's literally going to look kind of like an empty bag. Right underneath that is going to be this red tongue-looking thing. That's going to be our spleen. And then if we follow from our stomach going down towards the intestine, you can see this first part right here, in between here and here, that's actually a very hard structure. And that harder structure is going to be called the duodenum. And the duodenum right here separates the stomach from the small intestine, and your pyloric sphincter is actually going to be right in between the stomach and the duodenum. So after the duodenum, we're going to follow this down, and this is all going to be our small intestine. So the first part of the small intestine is the duodenum, and the second part is right out here, and that's the jejunum. And you can tell it's the jejunum, different from the ileum or the duodenum, because it's got all this mesentery. And all this mesentery is this like connective tissue, this webbing that basically connects all the jejunum to the blood system. And that's because the jejunum does a lot of nutrient absorption. So that nutrient absorption is going to happen in the jejunum, and then it's going to facilitate through the mesentery. So you're actually going to find these little veins and little arteries inside the mesentery, and that's going to be your mesenteric veins and arteries. So if you were to spread this out, you can see all this mesentery here. Well, at one point, this intestine kind of balls up by itself. It's kind of off to the right and only has a little tiny bit of mesentery. This is known as the ileum, also part of your small intestine, also used for nutrient absorption, but also water absorption. So in between the ileum and the spiral colon, which is considered your large intestine, but we don't use words like that. We use ileum and jejunum, because those are what actually is going to be on your test, not small intestine, so don't call it the small intestine. So when we get to this spiral colon right here, which is our large intestine, but we're going to call it the spiral colon, in between the spiral colon and the ileum is going to be this tiny finger-looking projection. And it's almost this dead end where all this is connective and keeps going. This little tiny finger projection is known as your cecum. And that's going to be the dead end in between the ileum and your spiral colon. After the small intestine, we get to our large intestine, which is our spiral colon. And then coming down from our spiral colon, down, 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 the kind of back of the body is going to be the rectum. And again, it looks just like the large intestine material. It's going to be coming down as this rectum-looking thing, finally out towards the anus. Okay, so now we're going to go over some of that central body cavity. So again, remember this membrane that was covering this whole lower body cavity here, that's our diaphragm, and you can see how thick this membrane is. And then the most noticeable thing in here is the liver. And so usually it's blue, sometimes it's this brownish color. And again, this is the liver, and this whole large part of it here is the liver. So there are actually several different lobes of the liver. So all of these lobes that are the same material, these are all our liver. This again is our umbilical vein that we cut, which was going towards our umbilical artery, or our umbilical cord right here. So we cut this and flapped it down. If we lift up the liver very gently, we want to use our tools and not our fingers so we don't damage anything, what you can see under the right hand side is this little deflated sac right here. And this little deflated sac right here is our gallbladder. So the liver produces the bile, this gallbladder stores it. And then coming down from that, this little tube, that is our common bile duct. And again, that's to transport the liver from the gallbladder to the duodenum. Okay? So then on the right hand side here, we've got this deflated little bag here. And this deflated bag is going to be our stomach right underneath the liver. And if we lift that up, kind of right attached to it is this red tongue-looking thing. And that red tongue-looking thing is going to be our spleen. This guy right here. That guy right there. Okay? So then as we move on, this first part of the stomach coming off, so again, this deflated sac is our stomach. This first hard part right here, this, and you can see how hard it is compared to the stomach, this is our duodenum right here. That right there. And then if you follow this down, you can see all of this small intestine. All of this right here. So if we spread this out, what we see is all this connective tissue that I was talking about. And this is all that mesentery. So these are all the mesenteric arteries and the mesenteric veins. And all this connective webbing right here, that is all mesentery. Which means this on the outside, this intestine-looking thing right here, this is our jejunum. Because our jejunum has all of this mesentery connecting it right there. So then if we work our way over to the right, you can see appears that this is its own little part that kind of falls off by itself right here. And this has very little mesentery, and it kind of falls off here to the right. And this is our ileum. So this part all the way out here with very little mesentery that kind of falls off into its own little ball. That's your ileum right there. Now we've got this giant colon-looking thing in a spiral. You guessed it, that is our spiral colon. And right in between our spiral colon and our ileum, it's going to be a tiny little dead end. And that tiny little dead end finger-like projection, let's see if I can find it, there he is, right here. This dead end looking guy right here, and you can see how it's the only dead end in all of this intestine. So it keeps going and keeps going and keeps going, except this little finger-like end point right here in between the ileum and the spiral colon, that's our cecum. Very small and kind of hard to find, but if you look right there, you can see this little dead end finger guy. That is our cecum. Okay? And then on either side here, sorry, you can see it's a little wet, but you can see these giant bean-looking things, and that's going to be on either side of the pig. These are his kidneys, right? You've heard of kidney beans? These are giant kidneys. And if we follow it down, in between the kidneys, heading from the small spiral colon down towards the anus, this is going to be your rectum, right here. And this is where non-digestible material passes through, and then out towards the anus. So next I want to go over the circulatory system diagram, because again, a lot of the students will cut these veins and arteries away. So I really want you to have a clear picture of what they're supposed to look like, so even if you don't see them in your pig, you'll still have an idea of how we could test you on them. And then if you know the simple numbering system, you guys will be fine. Okay, so I want to start off up at the top. And again, imagine your larynx is right here. You've got your bumpy tube in the throat, that's your trachea. And then sitting right here is your little thyroid gland. So on either side of the throat, there's going to be two jugulars and a carotid. They're all going to kind of be stacked on top of each other. And so you're going to have the big blue ones are going to be your jugular, and the big red one is going to be your carotid artery. So remember, the blue jugular vein, red carotid artery. So when I'm going over this, I kind of want you to count from 1 to 5. And this will be basically how you tell the veins apart. So we're going to start with jugulars 1. Remember, we're just going over the veins. So this jugular, this big blue one, is going to be 1. And we're never going to ask you the difference between the internal jugular and the external jugular, or left and right. We're only just going to say this is our jugular. The first branch off the jugular, so you can see it comes down here and connects here. This first branch is going to be your cephalic. That's number 2. Your subclavian follows. It's this second branch, but only from right here to right here. This part only is going to be your subclavian. That's going to be number 3. Connects off of the subclavian, it's going to branch into an upper and a lower. The upper is going to be your subscapular, that's going to be 4, and the lower is going to be your auxiliary, that's going to be 5. And it's going to be the same on both sides. So even if you cut some of these away or you don't get a chance to see them very well, that's okay, because if you can count to 5 and you memorize them in this order, we're going to make it that clear on the day of the test. So next up is our brachiocephalic vein. That's this area right here. Now brachiocephalic seems like a big scary word, but it's actually not. It means branches of the cephalic. Well, you know the cephalic's right here. Here's all these branches. Okay, so it's the center of all the branches near the cephalic. So that's your brachiocephalic vein. Now if you come down here, this basically where all these veins meet, this is going to be your vena cava. And we went over the vena cava a little bit with circulatory system in the heart already. So this is your inferior and your superior, or your cranial and caudal vena cava, where it dumps into the heart. Now, going across the heart, this artery that basically bisects the heart at an angle, that's going to be your coronary artery. And coronary again means heart, so it's going to be the artery that goes over your heart. Coming out of the heart here, which we already learned about, is a pulmonary artery. Going back in is going to be the pulmonary vein. And right behind it, in this very distinct arched shape, right behind the heart. So you kind of have to pull the heart down and forward and look back here. And that's going to be your aorta. This aortic arch right here. And that's going to go, again, down towards the rest of the body as well as up. When it goes up, this first branch right here, off the aortic arch, that's going to be your brachiocephalic trunk. Again, branches of the cephalic, but this is going to be your brachiocephalic trunk, not your brachiocephalic vein. So 2 very clear distinctions based on if it's an artery or a vein. Okay, so the circulatory system is very hard to dissect without cutting away these veins and arteries. So what I wanted to show you guys was those counts that I gave you based on the diagram. So you can see jugular 1 here, jugular 2 here. Both sides, again, I've splayed the pig open, so if he was sitting naturally, these would be much closer together. And so this is a jugular and this is a jugular. This red one right here, this is going to be your carotid artery and your jugular veins. So again, we've got 1 jugular veins, and you can see it follows down here. This is that brachiocephalic trunk, that central area. And then here's the cephalic. So you can see the first branch after the jugular, that's going to be your cephalic right there. Goes all the way across, it's almost about to break. Which again, is very, very hard to do. Now this one, it's actually, the veins are hiding under this artery right here, but you can see the general shape. So again, we've got 1 jugular, 2 cephalic, 3 is your subclavian from here to here. So you can see it's the second branch off this brachiocephalic trunk after the cephalic from here to here only, this first section. And then it's going to branch upwards. This upper branch is going to be your subscapular, and this lower branch is going to be your auxiliary. So again, 1 jugulars, 2 cephalic, 3 subclavian, 4 subscapular, 5 auxiliary. And your brachiocephalic, your brachiocephalic vein right here in the center. Remember, this big blue area is your brachiocephalic vein right there. So continuing on with the circulatory system, we've basically followed the aorta and the vena cava all the way down the body. And then you're going to see these giant bean-looking things on either side. These are your kidneys. And so where the aorta and the vena cava branch off and enter your kidneys, This is going to be your renal vein and your renal artery. And again, renal means kidney. So as long as you remember that there are the veins and the arteries going in and out of your kidneys, you should be fine. So again, renal vein, renal artery, depending on their color, coming in and out of your kidneys on both sides. Following this down, we basically have these two little arteries kind of offshoot, and this offshoot going up towards your umbilical cord. These are going to be your umbilical arteries, right? So they're going to follow all the way up to your umbilical cord. And we already cut the umbilical vein. Remember, that was attached to the liver. That's the first thing we had to cut to open up all of this intestine so we could see all this. And sitting in between both of your umbilical arteries on either side is this giant bladder thing. And it's kind of look like a little sac. And that's your urinary bladder. And again, because that's where it's going to lead to your urogenital opening and release this urine that is going to be basically stored, filtered in the kidneys and then stored in this urinary bladder. So these umbilical arteries are going to be going up near the urinary bladder attached to your umbilical cord. Now as we follow this all the way down, basically right where this umbilical cord and the umbilical arteries kind of branch off, you're going to have this split of the aorta. And it's going to split to two sides. Each one of those sides are going to be your iliac. So the first split off the aorta, kind of down towards near the legs, really like the hip area, that's going to be your iliac. And then when it splits again on both sides, it turns from your iliac into your femoral on both sides. So iliac first, and then femoral, femoral. And that basically sums up the circulatory system. Okay, so again, these are our umbilical arteries right here. The umbilical arteries going up the umbilical cord. That little blue circle here is the umbilical vein, which we've cut down here from the liver. And right about where this branches off here, you're going to have this branch off the aorta right here. And that's going to be your iliac. So this area is going to be on both sides. So you're going to have one iliac here and one iliac here. As soon as that iliac branches again, that becomes your femoral and your femoral. So this part right here is your iliac until it branches again. That goes femoral, femoral. And that branch from the iliac is always going to be right around where that first umbilical artery is, right there. Okay, so continuing on to our reproductive and excretory system. You've basically got, so now we're underneath the liver, underneath the stomach. This is your pancreas. Remember I said it was that white, fatty looking material? This is our pancreas. And then right underneath that, again, we've got our spleen right here. And this giant bean looking thing, this is our kidney. Coming out of the kidney, going to the urinary bladder is this white structure right here, this squiggly line. That is your ureter. And again, that's transferring urine from the kidneys all the way out into that urinary bladder where the urine is stored. Remember, this is our colon, our rectum, coming down from our colon. And that's moving that non-digestible material out. Going in and out of the kidneys here, and I know it's a little hard to see, but bear with me. We've got this little red artery right here and this little blue vein back here. And those are going in and out of the kidneys. And they're always going to be on the inside, right about here in this area of the kidneys. Now what's going to be really hard to see is this tiny little guy right here. This is the little gland right here that normally, because I'm pulling it back, is far away from the kidney, but normally this would be sitting right here, sitting on the top and the inside of the kidney. This tiny little flap right here, that's the adrenal gland. So remember, these are the renal arteries and veins, because renal means kidney. So adrenal, meaning on top of the kidney gland, adrenal gland right here. Which is going to be sitting on top of that kidney. Now as we work our way down here, this is a male. So what we've got is we've got our urogenital opening here, right underneath the umbilical cord. So this is, remember, that external anatomy part. This is the umbilical cord. This is his urogenital opening here. If you were to follow this down, and if it's covered in skin, what you can do is you can kind of rub your fingers back and forth and you feel this little tube. That little tube is actually going to be his penis. So then you can cut away all this excess skin, and there's going to be a lot of excess skin in between the urinary bladder and the penis. But to see it very clearly, you want to cut away all that skin in between. So then as you follow this down, you're going to get to this bulbousy glandy looking thing right here. Right on top of the penis, right before you get to the urethra. That is going to be your bulbourethral gland. And bulbo, again, kind of just means bulbousy. So this big kind of fleshy, glandy looking thing right here, that's your bulbourethral gland. right off the penis. So then when this comes down and actually does a 180, there's going to be a small tube that connects this to the urinary bladder. That's going to be your urethra. So mine is actually covered right here. And so if I were to cut away, excuse that, if I were to cut away all this material in here, right about here, you should see this little tube that kind of does this 180 and starts going down here and then goes flip and goes whoop down in here. So you can't exactly see it. We'd have to dig a little bit deeper, but if you follow along your diagram, you should be able to tell what I'm talking about. And that is the urethra, again, going right up here to the urinary bladder. On either side here, you can see these are the scrotal sacs. So remember when we had them closed and it was covered, that's the scrotum. Each one of these individually is a scrotal sac. And then inside of these, if I were to kind of pick this membrane away, as I pick this membrane away, you can see this darker ball part. This actual round bean looking shape right here, that's the actual testy itself. And then you can see this tiny flap sitting on top of it. And that actually goes all the way around on the side. That is your epididymis. So this is the scrotal sac, this itself is the testy, and this little flap right here which comes all the way down and around, covering the testy, that is the epididymis. Okay, and then if we were to flap this urinary bladder down, what we see here is these very small tubes. And you have to think of it as kind of like a Y. And so the base of the Y is down in here, in this little hole area right here. And that's going to be your seminal vesicles. And that seminal vesicles is the base of the Y. These right here are the arms which come up from here and then out to this way, into this way. These are the arms of the Y. These are your vas deferens. And in girls, it's a very similar structure, but it's known as the horns of the uterus and the body of the uterus. But in males, it is the seminal vesicles, which is down in here, and the vas deferens, which are each of these arms of the Y right here. And now if you follow that down, 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 that actually goes all the way into the scrotal sacs and attaches to the testy. And that's for that transfer of semen and for storage in the testes. Okay, so again, this is a female reproductive system, very similar to a male in that Y shape, except that Y shape out here is going to be the horns of the uterus, and out here, the branch of the, or sorry, the body of the Y is going to be the body of the uterus. So we've got one of our branches out here, remove this, and our other branch out here. Now at the very ends of our branches are going to be these tiny bean-looking things. And these little bean-looking things are going to be her ovaries. So just in the male, it was his testy, this is her ovary. Sitting on top of that ovary, this little guy right here, is her oviduct. Okay? So now in a male, that was a testy and a and an epididymis, but in a female, it is an ovary and an oviduct. Now, the branches of those Y, these squiggly lines that you see here, squiggle, 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 these squiggly lines right here, these are the horns of the uterus. So the uterus is like that Y-shaped. These are the branches of the Y, these squiggly lines here. Now if you were to pull this way down, you can almost see on the inside, let's see if we can pull this up a little bit. You can almost see where these branches meet. There you go. It's a little juicy. Okay? And that you can see right there. This is the base of the Y. See where these branches combine? So one arm, this body right here, that is the body of the uterus. Okay? And that's going to go all the way down and out her urogenital opening back here. Now under all this material right here, it's going to be a little tube, and if you continue down the branch of the Y from right here, that's the body of the uterus, but if you keep going down here, this is actually her vagina. And then it comes up and out the urogenital opening. So her vagina is going to be buried under all this stuff here, so we would actually have to dig through this here. About right here is going to be our vagina. And going from the vagina to the urogenital opening, there's going to be a very small tube that kind of comes back up and goes in that 180-degree flip towards that urinary bladder. And that's going to be the urethra. And if you can see right here, you can kind of see how this attaches down here, but this tube kind of goes this way. Well, this is actually the urethra right here. So this white bit right here is where it connects down, and you can almost see the vagina below it. this other white tube that's down there below. So it's going down this way, and when this tube kind of comes up and goes whoop and does this flip upwards, this actually right here is where the urethra is. Now we're ready for the cleanup. So the first thing you want to do is you want to take these strings and slide them off from around the tray. You don't want to untie them because it'll be much easier next week if you already have him tied. So we take the strings and we just loosen them up so that we've basically just got a pig on a string. So then what we're going to do is we're going to pack anything that's exposed, we're going to cover that with damp paper towels. Damp, not wet. If they're wet, then you're going to start actually deteriorating some of your organs and it's going to be really gross next week. So what we want to do is we want to take a paper towel, get it wet, and then wring it out. Once we've wrung it out, then it's going to be kind of nice and damp, but not wet. And again, we're going to cover anything that's been exposed. So any of these organs or open spots that have been exposed, we're going to start packing with these moist towels. And again, the throat, the chest, and the body cavity, until it's all nice and covered, like so. And then once I get him covered just like this, I kind of take the strings and you almost wrap it around him. And the key is to keep him nice and closed. Again, we don't want anything drying out or starting to rot, so we don't want it too wet, but we certainly don't want it too dry. So once you kind of have him in this nice little pig ball, is then I wrap him again in even more paper towels. And these paper towels can be damp or dry, doesn't really matter. The whole point is just to keep him in this nice, closed, almost pig in a blanket. So then what we're going to do is we're going to place him in our plastic bag, and remember, never throw out your plastic bag. The original plastic bag that the pig came in can get thrown away no problem, but this plastic bag you have to keep all 3 weeks. So you're going to place him in the bottom, and you're going to kind of push out all that air, and then you're going to twist him up. So again, keeping all the air, as much of the air out of there as possible. And then with your tag with your name on it, your buddy's name on it, and your pig's name on it, you're going to basically twist tie that up so that you have a nice wrapped up pig. And then I kind of fold the plastic down just like that. This is going to go in your drawer with your TA's name on it. So it should say, in my case, it would be Stephanie. It'd say Tuesday at 11. So you would find the drawer that says Stephanie Tuesday at 11 and place your pig in that drawer. The next step takes us over to the fume hood. And now if the fume hood is down, all you have to do is lift this up, slides up, and then there's 3 buckets, and each of these buckets have very specific functions. So this first bucket is just for animal parts. So anything large that we can pick up with our hand, you want to throw in there. So we want to get all these large pieces out, anything that we can pick up with our own hands. So next bucket is going to be the place excess animal juices in this bucket, and this is that first bucket that we poured the liquid into. So any excess liquid that we're going to have, we're going to pour into this bucket, not down the sink. So then we have a tray with very, very small, tiny pieces on them that we can't pick up. So then you're going to take another dampened paper towel and you're going to scrape. And I'm going to scrape and scrape and scrape and get absolutely all the tiny little things off of it, so that any little thing that I can see gets picked up in this paper towel. Then the paper towel with pig bits only goes in the bin that says paper towel with pig bits in it. Any other paper towel that you have used can just go in the regular trash, but if it has pig bits on it, it has to go in this red bin. The final step is where we come over here to the sink, and now with our tray with no pig bits on it, we're going to rinse with soap and water and then stack neatly so that everything can dry. We never want to stack the trays right on top of each other because this is wax, and if it's not able to breathe, it won't be able to dry. And then the back of the classroom is going to smell really nasty after a couple of weeks. So you want to make sure that they're all stacked so they can aerate. So if this one's stacked here, that air can flow in and they will be able to properly dry.